Cuomo comes clean. Redemption. Is he finally turning human before our eyes? New York Governor admits the COVID nursing home deaths are 43% higher than previously stated at nearly 13,000. Hours after New York Attorney General accused state of undercutting number by 50%. Let's get into this a little bit and see what the AG has to say and see what that great human Cuomo has to say. Keep in mind, if you've seen any of my videos in the past about Cuomo, this video comes from a place of hatred. I think he's disgusting. I don't even call him human. But you always have to keep in mind, New Yorkers voted this guy in. He's on his third term now, probably run for a fourth. So what New Yorkers overwhelmingly want as a collective, that's their business. I don't live there, so I have no say in that. New York Governor Andrew Cuomo's administration has admitted that the number of deaths in the state's nursing homes is 43% higher than previously announced. State Health Commissioner Dr. Howard Zucker released figures Thursday that put the death tally at both nursing homes and hospitals at 12,743 as of January 19th, where previously the official count had been 8,914. The higher number resulted from adding in residents who caught the Rona in nursing homes and then went to hospitals where they later died. The bombshell report came hours after the state attorney general said numbers were undercounted by 50%. New York Attorney General Letitia James launched a probe. Letitia James. For some reason I was thinking of LeBron James. I was thinking that'd be, I guess, his female counterpart. Letitia James launched a probe into nursing home deaths last year at the request of New York Governor Cuomo. On March 25th, a directive from the Department of Health said all homes had to accept the 19 patients if hospitals didn't have room for them anymore, accelerating the spread among the vulnerable elderly. It saw more than 6,000 COVID-positive patients heading back into nursing homes between March and May. It's 2020, obviously. Cuomo dodged questions about the revelations on Thursday and did not schedule a press briefing, as he does every other day. Ducking it. State Health Commissioner Howard Zucker. Look at Boris Johnson. He always cracks me up whenever you see him. Howard Zucker released figures on Thursday that put the death tally at both nursing homes and hospitals at 12,743, which we read about above, where previously the official count had been 8,914. Zucker said the provisional data showed 3,829 nursing home deaths. Nursing home residents died from the 19 after being sent to hospitals. The number has not been reported by the state until now. Out of the 8,914 nursing home deaths previously reported, 5,957 were confirmed cases of the 19, and with a further 2,957 presumed cases. The figures came hours after New York Attorney General Letitia James said the state had undercounted nursing home deaths from the 19 by 50% based on information obtained across 62 nursing homes. But Zucker insists that James was wrong to say that the numbers were undercounted, insisting the New York State Office of the Attorney General report is clear that there was no undercount of the total death toll from this once-in-a-century pandemic. The change in nursing home death numbers does not change the total 19 death count for New York State, which now stands at 34,742, as the hospital deaths were included in the state's overall total, which is true. That is true. It doesn't change things. It just shows us where more of the deaths were from, and that was from nursing home patients. Cuomo killed Granny, as the old meme or expression went, and still goes to this day. There are now calls by state Republicans for Zucker's resignation over the fiasco. Zucker's announcement came after months of officials fending off requests for accurate information on nursing home deaths. State officials continued to deny requests, claiming the data was unreliable. There you see LeBron's better half. There on the left, that's Miss James. There is Mr. Zucker. The Department of Health has consistently found numerous inaccuracies when examining unverified data, and as a result, months ago, DOH began an audit of fatality numbers reported by nursing homes to ensure public release of these statistics were accurate, Zucker said in a statement on Thursday. But it does reveal a more intricate picture as to how deadly the virus had been in nursing homes, which is what I was saying. In March, an edict from Cuomo meant nursing homes were forced to take positive COVID patients after they were released from hospital. The order, which was later revoked, saw more than 6,000 positive patients heading back into nursing homes between March and May. It has been blamed for increasing the death count at nursing homes, which have been devastated by the pandemic. Until now, the true impact of the virus on such fatalities was being grossly underestimated. Cuomo dodged questions about the revelations on Thursday, and we read that above. He didn't schedule a press briefing, which he normally does, to toot his own horn. The revelation saw Republican New York Representative Elise Stefanik demand that James and the U.S. Department subpoena Cuomo's administration for documentation and communication regarding his handling of the pandemic. I don't think that's an unreasonable request. We'll see. Letitia James, you know about her. She's going after Trump pretty hard. New York State being what it is, I'd imagine she's a Democrat politically. So we'll see how the political ties in the machine work here. Will she actually proceed and move forward with some of the things that Ms. Stefanik is demanding? The Congresswoman said the revelations detailed in the report are indicative of a massive corruption and cover-up scandal at the highest level of New York state government, implicating the governor, secretary of the governor, the New York State Health Commissioner, and the governor's staff. The March edict that the governor put in place forced nursing homes to take positive COVID patients, put at risk our most vulnerable constituents. In New York State, Stefanik told Fox News on Thursday night. There have been advocates who have lost loved ones who have been asking for answers, accountability, and transparency, and at every turn the governor and his staff have smeared those individuals, she continued. Finally, today is a first step towards justice. Stefanik also asked for both Democrats and Republicans to issue subpoenas against Cuomo, State Health Commissioner Zucker, and his senior staff. They knew this number, and yet they refused to be transparent with New Yorkers. But what was most heartless is they weren't transparent with those who have lost loved ones, she said. You see the U.S. numbers here. There's Ms. Stefanik. In her report, James said that the New York State Health Department only ever counted people who physically died in nursing homes, rather than people who contracted the disease in nursing homes, but then died in hospital too. The report states that a March directive that nursing homes had to accept 19 patients may have contributed to a higher number of infection, but that it is impossible to directly attribute it to him. May have. Okay, so all right. James' office is focusing on whether the homes themselves are to blame for not containing the spread once the patients were already admitted. 20 are now facing investigation from her office. They are not named in the report, which also say that understaffed facilities had higher COVID death rates. The word undercount implies that there are more fatalities, that there are more total fatalities than have been reported. This is factually wrong, Dr. Howard Zucker said. Between March and May, when Cuomo reversed the directive after wider spread criticism, 6,326 positive residents were admitted to 310 nursing homes. Of the approximately 600 public nursing homes in New York, at least 323 homes had never had any infections until afterward the order, but there is no data on which accepted 19 patients and which didn't. Oh, that's a lot to work through there. Basically, they just, seemingly, and I get tracking and tracing is hard, especially back then at the infancy of things. You still had that moron Fauci telling you not to wear a mask at that time, and I get that it's hard to trace people, but it just seems like there was no plan whatsoever. They were just like, throw them wherever, send them wherever, we're not going to track them or trace them. And now that after it's happened, now that we have all of this data about all these deaths, they still don't have a clue on what happened and who did what. That's government at work, baby. People who caught COVID in nursing homes were then sent to hospitals where they later died. So as we read above, if you got it in the nursing home and then they booted you out, sent you to the hospital real quick, that death counted as a hospital death, not a nursing home death. That's why things were underreported. James does not, in her report, criticize Cuomo personally and does not directly attribute the high deaths to it. All the report says is that the decision may have contributed to it. Okay, so I think that answered my question from earlier. It seems like we know where this is going to go, that James is playing for the home team, so to speak, that there isn't going to be any retribution for this or any of the subpoenas like Stefanik was calling on. Probably not going to happen. While additional data and analysis would be required to ascertain the effect of such admissions in individual facilities, these admissions may have contributed to increased risk of nursing home resident infection and subsequent fatalities, whether due to actual transmission of infection from new residents to incumbent residents or due to the facility's poor self-assessment during the admission process that was followed by failure to provide appropriate care to that patient or other residents, the report reads. So you see what she did there. It's hard to call out the mafia boss, so to speak, and let's just refer to Cuomo as that for now. No disrespect to actual mafia bosses. They've actually probably killed less grannies than Cuomo has, but you see how she plays that game where it's cowardice. Like I said, she understands what she has to do in order to keep her career track going forward. Place the blame on nursing homes. Look, oh, it's their poor self-assessment during the admissions process. Oh, it's their fault for poor health care. They were understaffed. They were inadequate in their healthcare in every sense of the word. No, it's not the fact that all of these people were thrown into these homes and we have no idea who went where. We have no way to track it, as we also read above. It's not anybody at higher levels' fault. Blame it on the little guy. Kind of like how remember back when Wuhan was first jumping off, you would have individuals lower level that would be on the chopping block, that would lose their jobs, that would get disappeared, local to the Wuhan region. It wouldn't ever be anything at the top of the hierarchy. Blame was always placed elsewhere. The sacrificial lamb, so to speak. So in this case, the sacrificial lambs are going to be who's ever running these nursing homes, who's ever on staff at these nursing homes. And can you imagine if individuals tried to file suit? I'm sure there's a lot of cases out there where they're trying to file suit against Cuomo directly, the New York State Department of Health. All of those organizations, all they're going to do, being the political bodies they are, is they're going to point the finger at the nursing home and say it's their fault. Nope, go after them. It wasn't us. Go after them. Pretty sad and disgusting, right? James' office is now investigating 20 nursing homes, which may have not met safety and cleanliness requirements. Cuomo's decision to send thousands of COVID-19 patients back into nursing homes has been widely blamed for the high number of deaths among elderly people in New York. In May, the AP published the first report that New York was undercounting nursing home deaths, and the AG's office launched an investigation. Okay, so it took 8 months? Every other state has counted both. Interesting. Cuomo has resisted criticism for the directive, and he never apologized for it. The report points out that while widely criticized, the March 25 directive was in line with federal guidance that had been given. The point of the directive, from the state's view, was to ensure nursing homes were up to scratch. But nursing homes and the families of their residents angrily demanded to know why these 19 positive patients were being admitted in the first place, especially when healthy visitors were not allowed. Many nursing home industry and other commentators have criticized DOH's March 25 guidance as a directive that nursing homes had to accept COVID-19 patients who were infectious. At the same time, the March 25th guidance was consistent with the CMS guidance on March 4th. That said nursing homes should accept residents they would have normally admitted, even if from a hospital with COVID-19, and that patients from hospitals can be transferred to nursing homes if the nursing homes have the ability to adhere to infection prevention and control recommendations, the report reads. At the time, recovered nursing home patients were taking up much-needed hospital beds because there were delays in them receiving testing results back, and nursing homes were not accepting anyone from the hospital unless they had been given a negative COVID test. All right, everybody, I think we've got what we need. There's some charts going by. If you haven't seen those, just pause on it. Individual getting wheeled out to the hospital. This article goes on for a little bit longer. I'll just leave some here on the screen if you want to read it. The reality is, as much as I like to take a dump on Cuomo, because he comes off as a garbage human being, he's a liar. He just has that disgusting vibe about him. Chris Cuomo, same thing with, remember his COVID stunt? He sometimes, though, on his show, sometimes I'll catch some clips of all these different newscasts, but sometimes I can almost see a human in there. With Cuomo, that's even more rare. And I remember a time at the beginning where it seemed like he was getting some good publicity, and I was like, oh, okay, he and Trump had worked together on some things at the beginning of this. They were both trying to get things solved in terms of ventilators and hospital space. And it seemed like, back then there was a human in there. Now we can see in things that have transpired since then, how things have unfolded, that it was just a charade. Chris Cuomo, I know that a lot of you will probably disagree, but sometimes, like I said, that little spark inside of there, that there's still like a little tiny piece of that heart that's human. I wish that it would come out. But when you're getting paid $10 million a year to say whatever they want you to say, then it's kind of hard to resist that kind of money. I don't know. Would you take that kind of money and parrot whatever lies they want you to push? For $8, $9, $10 million, I think most people would. We read through this. I've given my thoughts on Cuomo. Letitia James, I doubt that this is going to go anywhere. And as we saw there in the report, it's what I touched on. Cast the blame at someone else to keep your political career on track. She's Attorney General now. What's next? Senate sometime down the road? Governor perhaps down the road? She has to keep her political aspirations open as well. So therefore, throwing the Don of the mafia under the bus, probably not a good idea for her. All right, everybody. Let me know what you think. Cuomo comes clean. Didn't see anything in the article about him coming clean. Pop some comments up on the screen so you can pause it and read those. Everything seemed pretty negative to Cuomo. So that's all I got, everybody. Take care, be well, and hopefully for those of you who live in New York, if you're out there watching this video, hopefully it wasn't a situation where Cuomo and his idiots in charge like Zucker ended up putting your relative or loved one in harm's way. But again, I'm not going to sit here and place all the blame at his feet. First of all, it's always with China. It's always the China virus. It's always going to be the Wuhan virus. But these decisions he made, costing people their lives, it's just disgusting if he isn't held accountable in some way. So take care, everybody. Be well.